All right, thank you everybody for joining us today. Today we are going to be talking about the Fatal Five. We are joined by Annette Dunnah from the Arc of Monmouth. Annette has over 30 years of experience in the intellectual and developmental disabilities field and over 25 years of experience as a registered nurse. She is a certified developmental disabilities nurse and a board-certified nurse coach. Annette currently serves as the Senior Director of Health Services for the Arc of Monmouth, where she oversees the operations of the organization's clinical services, which include primary care, psychiatry, mental health counseling, physical therapy, occupational therapy, speech, nursing, and behavioral supports. Annette holds a Master of Science in Nursing Administration and a Bachelor of Science in Nursing. So while we are here to talk about Fatal Five, before we get started, just a reminder that you have captions enabled and you can move them around your screen to where you're comfortable. You are also free to type any questions in the chat box or in the Q&A box. We will be here monitoring the chat if anybody has any sort of technical issues, either with the audio or the video. Please feel free to send us a message and we can help with that on the side. And if you have any questions, again, the chat box and the Q&A box are open. If we do not answer your questions during the webinar, we will respond to you within 24 hours of this webinar. So again, thank you so much for joining us, and thank you, Annette, for being here to talk about the Fatal Five.
Sure. And thank you, Erin. Thank you for having me. Hello, everyone. Let me just make sure this is advancing. So as Erin mentioned, my name is Annette Dunnah, and I'm a registered nurse. I feel very honored to have had the opportunity to be in this field, working with people with intellectual and developmental disabilities for more than 30 years. I'm also a board certified nurse coach, so I work with people to help them achieve their health and wellness goals. So today we're going to be talking about the Fatal Five and the conditions that we're going to be talking about: aspiration, dehydration, constipation, seizures, infection, including sepsis, are conditions that for many people in the general population don't end up to be conditions that would cause someone to be severely ill or even possibly die from these conditions. But many of the people that I've worked with over the years may be at higher risk for poor outcomes from these conditions for a variety of reasons. And what I've learned over these years is that when people have an understanding of the conditions, how they develop, how they're treated, people do better. So knowledge and action are the key to helping people do well. So excited for us to be able to talk about these conditions and what we can do about them. All right, so first we'll start with aspiration. So aspiration is when food, liquid, or other material might enter someone's airways or lungs by accident. And this is a very common cause of death. People with intellectual and developmental disabilities. And oftentimes, when I look at hospital discharge forms, aspiration pneumonia is a very common diagnosis. And so there are some risk factors that may increase someone's potential for aspirating. So some of them include a decreased or an absent gag reflex. So a gag reflex, if you've ever been brushing your teeth and your toothbrush kind of hits the back of your throat and you make kind of like that, like gag sound, that is a gag reflex. And that is an involuntary reflex that triggers muscles in the back of the throat to help keep us from swallowing something that we shouldn't swallow. And so sometimes the people we support or a person with an intellectual or developmental disability might have a decreased or absent gag reflex. So it's very important to know if someone has a problem with a gag reflex, because that lets you know that there is a higher risk factor for aspirating if something is swallowed and goes down the wrong way into the lungs. Weakness of the muscles that are used in chewing and swallowing poor positioning during meals. And I find this particularly concerning when someone uses a wheelchair. We have to make sure if we're going to support someone to eat and they use a wheelchair that they are sitting upright before we provide any foods or fluids. Because if a person is slouching a little bit in their chair and you try to drink something or eat something, then you have a higher risk of whatever you're trying to eat or drink not going down the throat into the stomach like it should, and it could potentially go into the lungs and cause aspiration. Medication side effects that relax the muscles that are used for chewing and swallowing. There are a lot of medications that people may take that could impact chewing and swallowing, so we want to be aware of that. And also eating too fast or having too much food in the mouth while eating. If the mouth is too full, there are chances of things ending up in the lung and causing an aspiration. So these are some of the things that you want to be mindful of because they are risk factors. Some other risks that we want to be aware of has a lot to do with the food textures. And so we want to talk about foods that can be difficult to chew or swallow because these are things that can increase the risk of choking. And choking is when a person can't breathe due to a blocked airway. And so some of the things that increase the risk of choking are things like meat chunks, right? So meat that's kind of hard. Hot dogs are a risky kind of a meat because of the shape of a hot dog. It really is the shape of the airway. So if someone has chewing or swallowing difficulty and they're eating hot dogs, the risk of choking can be higher. Raw, hard vegetables, raw, hard fruits, grapes, bread that is very chewy, a chewy consistency of bread, especially if that's mixed with something sticky like peanut butter or caramel. I can't tell you how many times I've seen someone have a choking episode because of something like peanut butter on a chewy bread. So we want to be very mindful of these kind of food combinations. Also, hard candy that are slippery. You know, you have these very colorful, slippery candies. Those can also increase the risk of choking and aspiration. So, as we talk about aspiration, we also have to talk about gastroesophageal reflux disease, which is also referred to as reflux, right? And reflux is the backing up of stomach contents into the throat. And oftentimes, reflux is not diagnosed until major harm has been done to the bottom of the throat. So, usually, we have a ring shaped muscle that is between our stomach and our throat that helps to keep food from going into our lungs. But when you have reflux, then that muscle isn't functioning well. As you can see from this picture, the muscle is not functioning well, so food and fluid have the ability to slide back and forth between the stomach and the throat. And that is where the risk of it going into the lungs is much higher. Medications that cause constipation also contribute to people developing reflux. And people who tend to carry weight in their stomach, they also have a higher risk of reflux. And it's really important because in addition to aspiration, if reflux isn't treated well, it can cause inflammation of the throat. It can also lead to conditions where the throat becomes thick and red, which can lead to cancer over time. It can also cause something called a stricture, which is a narrowing or a tightening of the throat, which can make swallowing even more difficult. So we really want to diagnose reflux early, treat it early to decrease our risk of aspiration and other complications that can come from reflux. So how do we look for reflux? What should we be looking for? So some of the symptoms that we see with reflux include heartburn, difficulty swallowing food. Some people may feel abdominal or chest pain, They may feel like they have a lump in their throat. So any of these things could be a sign that the person has reflux and that should be evaluated. We want to recognize signs of reflux, especially in people who don't use words to communicate, because this is really important in reducing the risk associated with this condition. One of the things that may contribute to a lot of these conditions not getting caught early is because many people with intellectual and developmental disabilities may show discomfort, pain through the way they behave. So, anytime we see a change in someone's behavior, we never want to look at it right away as it's a psychiatric issue. We always want to rule out a medical issue because if you're not able to verbally say how you're feeling, all behavior is communication. And so the way the person may be communicating pain or discomfort might come across through other ways. So people who are exhibiting food refusal, coughing when laying down, physical or verbal outbursts, especially around meal times, or someone who might be having distress in the middle of the night might be trying to tell you that they're experiencing reflux. I worked with a young man once, and the staff who supported him in his group home called me to say that he was running around at night. He kept getting up and he was running around the room, and they were thinking maybe he needed to see his psychiatrist. And so we always go off of the idea of all behavior is communication. So whenever we see a sudden change in behavior, before we think about a psychiatrist, we always say we have to rule out a medical cause for this change in behavior. So we got him an appointment with his primary care provider, who was concerned that maybe this was a digestive issue, referred him to a GI doctor who was a specialist in looking at digestive issues, and he had very severe reflux. And so that is why he was getting up in the middle of the night and running around the room. So once he got medication and the reflux was under control, he went back to sleeping well throughout the night. So had we not made sure that we checked for a medical reason, he could have ended up on more medication that would have actually made the situation worse for him. So always rule out medical. That is like the golden rule when it comes to these conditions. Pica is a behavior where people eat things that are of non-nutritional value. Pica could also be a sign that maybe the person is experiencing reflux. And the thought behind this is that because stomach acid burns, when you chew on something that's not nutritional, and I've seen people chew on clothing, things like that, it increases the saliva production. And saliva is what you call alkaline. So when you have more saliva, it kind of acts as a cooling to the stomach acid that's coming up. So pica could actually be a sign that someone is trying to self-medicate. So if you see someone who has pica, we definitely want to rule out reflux and a medical reason for the pica. So now we're going to talk about constipation. And I have to say, constipation is probably one of these 5 conditions that over the years has gotten mislooked the most. And maybe it's missed because people respond more behaviorally if they're not able to verbally express how they're feeling. So, constipation can be very, very uncomfortable. And so people may respond in very physical ways to how uncomfortable they're feeling from constipation. Constipation is a problem with passing stool or poop, also called a bowel movement. It usually means that someone is having less than 3 poops a week. And constipation can happen from conditions that affect the muscles and the nerves. It may interfere with the body's response to the bathroom. So the message might not be getting to the brain that, hey, I have to go to the bathroom. Some conditions can cause that to happen. People with mobility issues may not have a lot of activity. Exercise is very important for regular bowel function. So the more we can get moving, the better it is to help us with preventing constipation. Poor swallowing issues can make it difficult to eat and drink adequate amounts of fiber and to drink the right amount of fluids that is necessary to avoid constipation. And medication is a huge contributing factor to constipation. And you can see here from my slide, all of these different medications all have side effects of constipation. So if people are on multiple medications to treat multiple conditions, and all of these medications have a side effect of constipation, the chances of developing constipation are even higher. So it's important to know what medications you're taking and if those medications have a side effect of constipation and to really monitor for it. Poorly managed constipation can lead to the worst health outcomes. It can cause what you call bowel perforation, which is a hole in the digestive tract. It can cause a bowel obstruction, which is a complete blockage in the digestive tract. And it is one of the most common preventable causes of death for people with intellectual and developmental disabilities. So I always say, if someone has a change in behavior, if something just seems off, look for constipation. Because if you look for it, then you won't miss it. So always think about constipation and if this could potentially be a problem. So here on this slide, we have the Bristol stool chart, and this is a great tool for determining whether or not someone is having a healthy bowel movement. So the Bristol stool chart outlines 7 different types of stool. And so this can be a great tool for staff that is supporting someone to recognize what might not be a healthy bowel movement, and also for anyone who's concerned about their bowel health to know whether or not they're having a healthy bowel movement. So as you can see here, if someone is having stools that are type 1, it looks like little small hard lumps of stool, that is an indication of severe constipation, right? So that is someone who we need more fiber, we need more fluids, we need to really get them to have a stool that looks more like type 3 or type 4. Other signs of constipation: bleeding from the lower part of the digestive tract, which is called a rectum. Hard protruding abdomen. So if the stomach is hard and high, that's a sign that the person could potentially be constipated. A sausage, lumpy-like stool. So here on the Bristol stool chart, that's like type number 2. Refusing to eat or drink, because if the person cannot verbally tell you that they're really uncomfortable, maybe they will refuse to eat or drink. You may, if someone is vomiting and you smell like food that smells kind of like feces, that could mean there's a blockage going on. All right, so we really want to look for all of these signs. I worked with someone who didn't want staff to come into the bathroom with him, but he needed some help in monitoring what kind of bowel movement he was having. So we worked to understand these different types of stool here on the Bristol stool chart. And he was able for himself to look at the chart and come back and say, hey, yes, I'm having a normal stool. I'm having a type 3. I'm having a type 4. Or identify when something was abnormal so that he could reach out to his nurse or to his primary care provider for treatment. So this chart can also be a good visual tool that people can keep on the back of their bathroom door if they need something to refer back to, so that they can know whether or not the bowel movement they're having is normal. We want to avoid this. So this is a fecal impaction. So this is what happens when stool fills up the colon, which is our digestive tract, and it gets hard, right? So as you can see here, if you think of the digestive tract almost like a balloon, If it gets filled up, it's going to stretch out. And this happens when there hasn't been an adequate bowel movement for days or weeks, and you get a very large compacted amount of feces built up in the digestive tract. Anytime someone isn't having a regular bowel movement, whenever they're not going to the bathroom and to have a bowel movement, the body starts to reabsorb the water out of the colon. So this feces gets really hard. It can be almost like concrete. And so it's very, very, this is how it builds up and becomes the next thing we're going to talk about, which is an obstruction. The key here is that with close observation, consistent treatment, adequate time in the bathroom, adequate time for the person to just sit and use the bathroom. As you can see from the picture under recovery, this can be resolved. We can get rid of this huge mass of material that's in the colon, and the person can recover. But if we're not monitoring and treating constipation before it gets to even this space of an impaction, if we're not monitoring it and get past the impaction, then we could end up where we have a medical emergency. And this is a bowel obstruction, right? So a bowel obstruction is a complete blockage of the GI tract. And people with pica might have a higher risk for bowel obstruction because, again, if you're eating things that are not food, there's a chance of it blocking off the intestine. This is a medical emergency. So this is what we don't want to happen. This is why we have to monitor for constipation, treat it early so it doesn't turn into an impaction and then turn into an obstruction where the whole colon is blocked off. And what can happen at this point is what we call a perforation, where if you're thinking about the digestive tract as a balloon, it can burst. And then you have all of this fecal material spilling into the body and causing what we're going to talk about later, which is sepsis, right? An all over body infection. So adequate control of constipation is so, so important. So we never get to the place where we have a bowel obstruction and we have something like this. So many years ago, I learned about someone who passed away from this bowel obstruction. And before we got to a place where he was having a bowel obstruction, because he didn't use a lot of words to communicate, he was communicating behaviorally to the people around him that he wasn't feeling so well. So first it started with refusing to eat. He wouldn't eat, he wouldn't drink. At one point, he was so uncomfortable, he turned over a table and he kept going to the emergency room, but they kept thinking it was maybe a psychiatric issue. And it wasn't until he was really, really sick that they realized that everything he was experiencing was because he was having a bowel issue, right? And so he ended up having this bowel obstruction and this, his bowel burst, this perforation, and that is how he passed away. And so we just tell the story to say we always want to look for constipation, right? If you look for it, then we won't miss the early signs and end up getting to the place where there's something like an obstruction. So how do we prevent constipation? High fiber diet, right? So we want to eat things that have good fiber content, things like apples and nuts, whole grain cereals and pastas and bread, applesauce. These are all things high in fiber. We want to have adequate time for bowel movements. We don't want to rush through it, right? Just, give your body time. If people need laxatives, we want to make sure that they're getting laxatives as ordered by their healthcare provider, as much exercise as possible. I worked in a residence once where everybody was in wheelchairs, but we would do sweating to the oldies, Richard Simmons, just to bring in as much physical activity as possible to help movement, because movement is so important for regular, bowel movements and for bowel health. Adequate fluid intake, very important that people have access to fluid, that they're drinking. We want to look at those medications, see with our healthcare provider, are there opportunities to reduce medications that can cause constipation? We want to track the bowel movements. We want to know what type it is. Like we saw in the Bristol stool chart, is it a 3 or a 4, that the normal type of bowel movement? And if not, get support so that we could have normal bowel movements. And limit food with little or no fiber. Things like cheese and meat and processed foods, it's not going to help with the constipation. So we want to seek medical support if it's been 3 or more days, or as directed by the healthcare provider, someone has not had a bowel movement. We want to make sure that we are seeing someone about that. If people live in residences, they should have a bowel movement protocol that tells you when you should be using prescribed as needed medication. If someone has just started a new medication, a new vitamin, a new mineral supplement, and you're starting to see that they're having constipation, this is something that should be discussed with the healthcare provider. And if constipation is ever accompanied by blood in the stool, fever, or abdominal pain, that's immediate medical support, because this could be signs that constipation is progressing to something more serious. All right, so now we're going to talk a little bit about dehydration, which is another one of the fatal 5 conditions. And so dehydration is when the body doesn't have enough water and fluid to carry out its normal functions. And so again, people at higher risk for dehydration are people who may have difficulty swallowing. Dehydration can also make some of the other conditions we've talked about worse, because you need adequate fluid to prevent constipation. If you have a seizure disorder, not having enough fluid in your body can make seizures worse. So sometimes, one thing can cause multiple of these conditions to occur. So dehydration is very important. We want to avoid dehydration. People with fever or vomiting have an increased need for fluid, so we want to be aware. So recently, I had someone who has a swallowing issue and needs all of their fluids to be thickened. He got very sick with a stomach bug, and so he was vomiting, and then he developed a fever. And then shortly after, he became dehydrated, right? So already he was at risk for dehydration because he had a swallowing issue. He needed all his liquids to be thickened, but then he got sick, started vomiting, had a fever, and those conditions made the dehydration worse. So anytime someone isn't well, think about the fact that their need for fluid is going to increase. And also consider communication limitations can be a barrier to adequate fluid intake. The person who is unable to ask for a drink is the person most likely to suffer from dehydration. So we have to be thinking about, how are we going to make sure that the person who cannot ask for a drink has adequate access to fluid, so we can make sure that they do not end up getting dehydrated. So some of the symptoms of dehydration: dizziness, general weakness, flushed face. For older adults, you might see some confusion, no tears when crying, decreased skin elasticity. So if you are well hydrated, if you took your thumb and your index finger and you just pinch the skin on the back of your hand, when you pinch the skin, it should go right back down. But if you pinch the skin and it kind of sits up a little bit like a little tent, that could be a sign that you're not adequately hydrated. So that's what we call skin tenting. So mild to moderate dehydration can be corrected by drinking water alone, but if dehydration is a little more severe, it can be a medical emergency. The person probably needs IV fluid and other ways to get them rehydrated. So severe signs of dehydration: sunken eyes, so the eyes look really far back in the face, low blood pressure, they're not sweating, and a rapid heart rate. These are all signs of severe dehydration. So how can we avoid dehydration? I like this little illustration on the slide. I'm a big advocate for eating foods that have high water content. So things like cucumbers and tomatoes, watermelon, these are all great ways to bring in extra fluid. Also, carrying a water bottle. If you're going out, you want to carry a water bottle. In one of the residences that I worked in, everybody got together and decorated their own water bottles. So some people, put little diamonds on them. They got water bottles in their favorite color. They personalized them. And then everyone felt so good going out carrying this water bottle that they made for themselves. So that could be a nice little way of, you know, creating something that you like that speaks to your personality and also is going to help keep you hydrated. Increase intake of foods with high water content in the summer, in warmer weather. Make sure we're using air conditioners. You don't want to stay in temperatures over 100 degrees, especially if there isn't good airflow. You want to also drink throughout the day. People generally need about 8 to 10 glasses of fluid every day, unless they have some sort of a fluid restriction or other reason why they shouldn't drink that much. So look for opportunities to drink throughout the day. You can also have snacks that have high water content, things like Jell-O, diced fruit cups. These are all good choices. And if you are working with someone who doesn't have the ability to ask for a drink, you want to have a plan for how you're going to offer people fluids, right? So, for one of the people that I worked with, we just would every hour give a little bit of fluid because she was someone who had aspirated in the past. So she was a little fearful of drinking. And that's something to be mindful of too. People who have a fear of drinking have a higher risk of becoming dehydrated. So she had a fear of drinking. She really did not, want to see a big, huge glass of fluid in front of her. So what we did was, work with her to design her own beautiful cup. And then every hour we would put just a little bit of fluid in there, about an ounce. And she would take it and, swirl her cup around and take small sips of that little bit of fluid. And that was how we helped to keep her from becoming dehydrated. We didn't overwhelm her with a big cup of fluid, but we made sure we offered it throughout the day so she always had access. So this also goes back to really knowing the preferences of the person that you support and making sure that we can be flexible and come up with plans that are going to help them. All right. Another condition is seizure and epilepsy. So seizures, when they're not well controlled, can lead to respiratory complications, which can also lead to poor health outcomes. So a seizure is an abnormal electrical activity that's happening in the brain, right? And it can happen when there's a sudden abnormal electrical signal. They vary in appearance and severity depending on where they start in the brain. I've worked with people who their seizures would look like just them raising their hand. They would talk to you, normally, but one hand would be up. I had people who have brief, what looks like staring spells, and that's how their seizure looks. And I've worked with people who have had, seizures where they lose consciousness and there's a lot of convulsions. It really just depends on what is happening with that electrical activity in the brain. Epilepsy is characterized by recurrent seizures. So, the person will have a diagnosis of epilepsy when their seizures are recurrent. So there are a lot of reasons why people have seizures. Some of them could be, progressive brain conditions, head trauma, congenital conditions. It really just depends on where in the brain the electrical activity is happening. And these are some of the symptoms that you can see: rapid eye blinking, twitching in the face, shaking of the limbs, stiffness in the body. Seizure symptoms could look different. It really just depends on the person. So people with intellectual and developmental disabilities have higher incidences of seizure disorders than the general population. And there can be significant illness, because of things like respiratory complications or aspiration, which we spoke about. Drug toxicity, medication side effects can also further impact people who are taking medication to treat these conditions. So basically, balancing control of the seizures and the medications is very important for the treatment plan. So you want to have the right balance of medication. Having too much seizure medication is called drug toxicity, and this can also cause more seizures. So we want to make sure that people take medication the way it's ordered. They have enough in their body to control the seizure, but not too much so they're experiencing toxicity. So working with a neurologist, which is a doctor that specializes in seizures, is a very important step for keeping seizures under control. So for seizure management, if someone experiences a seizure, we want to make sure that we watch the person to make sure they're breathing well. If the seizure is something that they always have and the type of seizure they're having is normal for them, it's not necessarily an emergency for them. Some people have recurrent seizures. It's an emergency whenever a person has a seizure that isn't like whatever seizure they've had in the past. Anything that's new is an emergency. If someone has a seizure, we want to make sure that we have them lie down, loosen clothing around the neck. We want to remove eyeglasses. We want to stay with the person. We never want to put anything in the person's mouth or restrain them in any way. We do want to move objects away from them to prevent injury. If possible, we could put something under their head so they're not banging their head, maybe like a rolled up jacket or something like that. We only move people out of the area if the area is unsafe. And after the seizure has ended, we make sure people are comfortable. We want to give them quiet time to recover, continue to check on them to make sure they're breathing normally and they recover well, right? So here we have a little diagram from the Epilepsy Association that really talks about how to support someone when they're having a seizure and when you would call 911. So seizures that last longer than 5 minutes, if someone has repeated seizures, any signs of difficulty breathing, if a seizure happened and they were in the water, if the person is injured, if they're not returning to their usual state, or this is the first time they've ever had a seizure, or like I said, if this is a different seizure than they've ever had before, these are all things that are an emergency that we want to get 911 called for them. All right, and so now we'll talk about infection and sepsis. And so sepsis is a condition that results from a significant infection in the body, and it's the body's response to that infection. So it's important to know that any infection, if it's not managed quickly and effectively, can lead to sepsis. And so people with intellectual and developmental disabilities are 3 times more likely to die from sepsis than the general population. And again, this can potentially go back to communication. People who don't have the ability to verbally say how they're feeling, this can lead to sepsis going unnoticed. Healthcare providers who don't have experience working with people who may express that they're not feeling well more behaviorally. They may not screen as quickly as they should, which can lead to sepsis not getting diagnosed early. So early detection and treatment for these conditions are really, really important. Advocating, if you support a person with intellectual and developmental disabilities and they're not well, it's very important to advocate to the provider what the person is usually like and how they express when they're not feeling well. What do they do when they're in pain or not feeling well, uncomfortable, so that the healthcare provider can understand that this is not the person's normal baseline and something is wrong, so they can be evaluated properly to identify the cause. Symptoms of sepsis include a high heart rate, low blood pressure, fever, feeling cold, shivering, confusion, shortness of breath, pain, cold and clammy skin. The most severe complication is septic shock. And this is when the body goes into shock because of the low blood pressure. And so this is when the organs become affected. So when it comes to sepsis, there's a little this little diagram here from the Sepsis Alliance. I like to use it because it says when it comes to sepsis, it's about time. For every hour that passes where sepsis isn't noticed and treated, the less likely the person will recover. So the quicker we can get people help and evaluation, the more likely they are to recover from this all over body infection, which is what sepsis is, right? So just want to highlight that. So treatment and prevention. If sepsis requires immediate treatment, it will include things like IV fluid, antibiotics, oxygen. And how do we prevent it? We want to prevent infections by taking care of chronic conditions, getting our recommended vaccines, routine preventative care, going to our doctor. We want to treat infections quickly. We don't want to delay any treatment. UTIs can be a very common infection that we see. We want to make sure we get treatment at the first signs of a urinary tract infection. Good hygiene, washing hands, keeping cuts clean and covered, good personal hygiene, routine dental exams and treatment are very important. Dental infections can be very common and can lead to sepsis. Any signs of possible aspiration, because we don't want that aspiration to turn into a pneumonia in the lungs, that can lead to sepsis. So anything that we think could be an infection, we want to have evaluated. And finally, I just want to really close with just reminding everyone that you can make the difference, right? With all of these conditions, early detection and treatment of these conditions lead to a better health, lower risk of death, and improved quality of life. So it's important to learn more about these conditions, know how people express when they're not comfortable, when they're in pain. Advocacy is the key. Sometimes we have to educate healthcare providers about, how either we or the person we support expresses pain and discomfort so they can get us care at the earliest sign of illness. So that's all I have. I hope this was helpful. And thank you so much.
Thank you so much, Annette. That was so informative, and it's so important to know what to look out for and to help people kind of express, especially when they communicate in a way that is not as easily able to understand that they're in pain or that they need some support. So I really appreciate you coming on today and talking about this. Thank you
Very
so much.
cool. Thank you.